Okay. Well, well, hello everybody. Welcome to today's show. This is the Healthy Life and Healthy Joints with Dr. Dada. For those who don't know me, I am a rheumatologist in the greater Seattle area, helping people with autoimmune diseases and joint pain get their immune system back on track and become pain-free. And what do I have a treat for you today? Dr. Taiwo Durowade she's a phenomenal gynecologist. And today we're going to have the opportunity to really kind of dig into a lot of issues that women are dealing with. From my standpoint, a lot of my patients with Sjogren, which is an autoimmune disease that causes dryness everywhere, the women come in and they talk about dry eyes, dry mouth, but there's also vaginal dryness that a lot of women are even shy to share. So I'm going to let Dr. Durowade introduce herself, and we can't wait to dig into this matter.
Thank you, Dr. Ariola. Thank you so much for the opportunity to be on your platform and to share with your audience. As you said, I'm Dr. Taiwo Durowade. I am a gynecologist in the South suburban area of Chicago. I have a private practice that focuses just on gynecology, so all things women except pregnancy. My mission in life is to transform women's lives using medicine, using aesthetics, using whatever tools are available to me to get them the results that they want, especially dealing with quality of life. So as women get older, things just begin to deteriorate. And people or doctors may not know how to help them. Basically, their primary doctors may not know how to help them, and it just boils down to, well, you're just getting older, kind of deal with it. I don't believe that. I believe that there are things we can do to help you thrive no matter the stage of life you're in. So that's my practice. That's my passion.
Okay.
Yes. Go ahead.
Well, thank you. I was listening to you, and I'm like, Dr. Durowade is going to keep us like fine wine. Okay, we're going to get better with age. It's not going to be, no, that's just it. A lot of primary care doctors are just overwhelmed, right? There's so much they can do in the little time they have for you.
Absolutely.
So I think having the opportunity to really talk to a gynecologist like Dr. Durowade can really help us kind of make sure that we are continuing to age like fine wine and know, yes. 60 is the new 30, so
yeah.
longer, right? So thank you, Dr. Durowade, for letting us know that, hey, you don't have to just suck it up and live with it, right? There are things that we can do. So tell us, Dr. Durowade, gynecology would be could be from a 20-year-old all the way to 70. What are your passions, and why do you do what you do?
My passions are to, I alluded to that earlier. So what my goal is to transform a woman's life. So if a woman comes to me for abnormal bleeding, I want to fix that problem for her. If she comes to me with low sex drive, I want to fix that problem for her. And so I was finding that most people, I didn't have a lot to help women as they got older, and they just felt like their body was falling apart. I just felt that our regular cookie cutter options were either not a good fit for the patient or just were not working for the patient. And so I went and searched, what are other people doing? What are other doctors doing? And that's how I found hormone replacement and vaginal laser. Those two things together are so transformative that my patients use terms like, I feel like a new woman. And so
a woman.
Yeah. So hearing the feedback kind of fuels my desire to do more, to get more people aware that there are these options for them. And the patients that I see, most of them have gone to a gynecologist. They've gone to the gynecologist already, but they're, like I said, the options are limited. They don't have options for them, or sometimes their symptoms will show up as palpitations. And so they send them to a cardiologist. But it's all menopause. It's all getting older.
Yeah.
And so why I do what I do is because I get the results that I get. I change women's lives. They suddenly are brighter. They're thriving. I hear things like, this lady's in her 60s, but she's moving faster than the 20-year-olds who are working on the floor. You know, that's the kind of feedback that
Yeah.
pushes me to do what I do.
Wow. While we're at it, actually, you kind of mentioned an unusual symptom of menopause. Can we talk a little bit about that? What are the symptoms of menopause that, women may be experiencing and they have no clue that that's what it is, right? And then we can delve into kind of our topic for the day.
Absolutely. So for some women, it can show up, like I said, as heart palpitations. And so they go to their primary doctor, and the primary doctor sends them to a cardiologist. Cardiologist does all the tests and says, you're normal. There's nothing wrong with you. And they're like, something is wrong with me. It can show up as new depression. They've never had depression in their lives before. And suddenly there's this new wave of low motivation, hopelessness that is coming over them, or anxiety. They can't sleep. Yeah. They can't sleep at night. They're worrying all the time. And so those are the joint pains. Suddenly, knees, fingers, probably your field as a rheumatologist. Yes.
Yep.
And so all these things, because people think menopause, they think hot flashes, night sweat. Those are still the telltale signs of menopause, but some people don't have any of that at all. And some women completely, they're fine, except no sex drive.
Yeah.
And and then vaginal dryness, which is our topic for today, is one of the biggest issues women experience as they get older or as their bodies change. Their bodies change with pregnancy, bodies change with breastfeeding, body changes with menopause or getting older. Vaginal dryness is a big concern. And so I'm grateful that I have the chance to talk about it today.
Let's dive right into it. How do you even know that you have vaginal dryness? What kind of symptoms do you experience? Would a patient experience?
Right. Now, some patients say that maybe they're washing during their normal hygiene, they're showering in the morning, they're washing, and they get a cut. They get a cut just from scrubbing with your sponge or scrubbing with their wash towel. And they're like, the skin there is so fragile. The skin there is so thin. Any activity there causes bleeding or lacerations or cuts. The other thing is they notice it most during sexual activity. They don't have as much lubrication. It makes sex uncomfortable. And part of the things that gets a woman ready for sexual activity is actually desire. And so if their desire is gone, they don't lubricate, and then the vaginal environment doesn't even have the glands to produce the lubrication, and so sex is uncomfortable. Another sign of vaginal dryness is overactive bladder. So people have already gone to urologists. They've already been tested by their PCP for urinary tract infections, and there's no infections whatsoever. They just always have an urgency to pee. That's an evidence of vaginal dryness. Some people say, I have no issues during sex, but I'm always feeling like I gotta pee. There's vaginal dryness there. The other thing is recurrent vaginal infections. People say all the time, there's this discharge and there's this odor. And every time we're treating them for BV, they're like, why does the BV not go away? Vaginal dryness. All those things are what estrogen used to protect us against. So estrogen gives you lubrication, gives you bladder control, gives you pH balance. But when you lose your estrogen and the vagina becomes dry, those are the things you start experiencing. And so those are the telltale signs that there's vaginal dryness going on. There are more, I'm sure, that will come up later.
Yeah, and for our audience, BV is bacterial vaginosis. Right. So I think it's important. I think also I ask the questions because most women would assume that painful sexual intercourse is vaginal dryness, but it could be more than that. It could manifest differently, right? Correct. So thank you for kind of rehashing that with us. You're trying to keep clean and everything and you get a cut, right? Urinary tract symptoms, that's not kind of new for you, or this recurrent bacterial vaginosis that you're kind of going around in circles with your primary care doctor about. And those could all be part of vaginal dryness. So it's not just the painful sexual intercourse. Absolutely. It's also just the other things that kind of go along with it that you may not even be thinking that is related to vaginal dryness. Okay, so now that we know what kind of symptoms those are, and then we know at least how to even talk to the primary care about even bringing it up, right? And then next question, please, is what do we do about this situation?
Great question. One thing that came to mind when we were talking, another symptom is just pain inside the vagina. I had a patient, that was the only symptom she had, pain inside the vagina. And once I treated her, her pain was gone. So going to what we do about it, when I counsel my patients, I tell them there are 3 tiers, right? There is the low tier, there's the middle tier, and there's the high level tier, so the highest level of care. The reason for the dryness is loss of lubrication. And so we say you can use a moisturizer to lubricate the vagina. Those are over the counter. I'm sure you've heard of Replens, Refresh. There are some of these oils. There's a lady online that sells Chinese medicine compounded into an oil, into a tablet that then dissolves in the vagina. So those are lubricants. They can help with the lubrication part, but they don't give the vagina estrogen. They don't help to balance your pH that much, but they will help with the initial discomfort. Those are the things you can do for yourself, you know, because people try to sort of figure things out before they go to the doctor. So if it's dry, they think it needs moisture, vaginal moisturizers are an option. The middle tier is vaginal estrogen. The root cause of the dryness is loss of estrogen because you're breastfeeding, loss of estrogen because you're in menopause, loss of estrogen just because you're getting older. And so the vagina starts to react to that. So we can give vaginal estrogen. And that has been shown to be safe, even for patients with breast cancer. New evidence shows that we can actually prescribe that. We used to shy away from it, for women with breast cancer. And my hands were always tied, like I have nothing to offer this woman, you know? And
after
so now,
battling breast cancer.
I know. And then surviving that and now having to suffer the estrogen deficiency because of that. And so vaginal estrogen is good. It helps. It's usually twice a week. Initial treatment will be every day for 2 weeks and then twice a week after that. But it's something you have to keep doing every week over and over again. You have to keep applying.
And these are like pastries, pastries, vaginal pastries?
Suppositories, correct, suppositories. So the vaginal estrogen can come in the form of a pill. So you put a pill inside the vagina, or it can come in the form of a ring. And you just put the ring in the vagina and it can stay there for 3 months. And then there's the cream. So the pill and the cream will be the twice a week insertions inside the vagina. And those are to help keep the vagina giving it the estrogen it needs, helping to balance the pH, helping to reduce the irritation that the bladder gets from the vagina being dry. That's middle tier. I have people who don't do well with it. They either they don't like the cream coming back out later, or the pill is too expensive, their insurance wouldn't cover it. So there are a lot of caveats, a lot of reasons why people might not be able to get access to vaginal estrogen. Now, my top tier one, which I actually went in search for because of patients I couldn't help. Patients, I'm like, I have no tools whatsoever. They do not want estrogen. Even after counseling them that it's safe for breast cancer patients, they're like, I don't want to touch it. I don't want to risk it. And so I was like, what can I do for this woman? And then I found vaginal laser therapy. I'm telling you, it's even for me being the person doing it for the patients, I'm as transformed.
Really?
So it's when we use it's like a vaginal probe. It looks like an ultrasound probe. I insert it in the vagina, and there's a foot pedal that comes with it. And I press the foot pedal and it delivers laser energy to the vagina. I turn that 360 degrees, I turn it 360 degrees laser, another turn laser, another turn laser. There are like markers on there that tells you that you've made a full turn. And then you remove the probe like 1 centimeter, turn it again, full turn, 1 centimeter until you've treated the whole vaginal canal. And it takes like 5 minutes to do. And literally within 5 minutes, you do 1 pass, 2 passes, they're done. And then that's every month for 3 months. So 1 treatment monthly for 3 months. So 3 treatments, and that's it.
Question.
Yes.
Is this thing painful?
Not at all. It is not painful. There's actually a what's the word I'm looking for? Like a continuum. So women may be, those women I see in their 20s, 30s that are getting the treatment, they don't feel anything. Women who are older, who've had vaginal dryness for a long time, I have to start at a lower energy.
Energy, yes.
Yeah, I have to start at the lower energy so that they
Yeah,
don't
because
feel it.
yeah.
But their
Because
subsequent treatments,
Yeah.
subsequent treatments, they can tolerate higher energy because they've had the repair from the initial one.
Okay, because that was my question was, exactly was, how far into menopause can you really benefit from this, right?
Oh,
is there scar
woman.
tissue? Where are we,
It's so fascinating that there is the only thing that I've seen is when I use higher energy on my older patients, the tissue is so thin already that when you use higher energy, maybe they have spotting for like the day after. But after that spotting, nothing at all.
Okay.
And if I start with lower energy, they don't feel pain during the procedure.
Okay, so sounds like one, it's not going to be painful because we don't like pain. I help people become pain-free. Yeah, so it's not going to be painful. Okay. And then if one has been in menopause for a number of years and kind of just been sucking up and dealing with it, this is still effective, but your doctor is probably going to use lower energy. Correct. Okay. And then tell me how it works.
Great question. So it's basically causing microscopic injuries in the vagina. Okay. And then the brain is like, oh, there's an injury. Let me send all my antibodies and all my macrophages and all the repair mechanisms and repair the vagina. Okay. And basically, it's reversing the aging. It's reversing the trauma. So there's more collagen, more glands coming to the vagina. And that's actually what gives you the lubrication. More nerve endings. Oh my gosh. The feedback I did not even offer the results I did not even offer the patient was increase in sexual pleasure. Everybody's coming back to me saying, I noticed. What do you notice? What do you notice? Is your lubrication better? Like, girl, not even lubrication. The experience, the sexual experience is much improved with vaginal intercourse. There used to be an idea that women don't really have orgasms with vaginal intercourse because, the nerve endings are not concentrated there. But that's not the case with Femilift. It basically increases the nerve endings. There's more tone because more collagen, more tone. So women who've had children, they feel like the vagina is kind of lax. They have more tone and are able to better enjoy sex. Wow. And so those extra benefits were what I was hearing from my patients when I was treating them.
Well, so basically, sounds like, these days, we're trying to get back into having the body heal itself. So it basically sounds like using the laser basically stimulates your body to send all, our friends, the macrophages, to go in there, kind of get rid of all the dead, worn stuff, and then kind of rejuvenate. So you get younger down there.
That's literally the word, rejuvenate. That's literally the term. It is basically reversing the aging of the vaginal environment and giving you younger tissue. Yes.
You probably have a long wait list.
I love talking about it. I love talking about this treatment because you as the doctor, when you are getting these results for your patients, you're just pumped. I'm just pumped about it. I'm telling every woman who will hear that this is available for you.
Well, I think you need to spread the word because a lot of women are suffering. They're all in tier 1. They're going to the pharmacy, getting some topical lubricants, which is not really fixing the underlying problem. Underlying problem is that we've lost the estrogen, right? And so, everything is cracking, fragile. We're getting more urinary tract symptoms, more bacterial vaginosis. You even getting palpitations. You don't know where it's coming from. Right. So all these menopause symptoms. But you can, at least from that aspect, which I think, and actually, the lack of sexual intercourse and interference with the relationship probably is it's another cause of anxiety and stress, right?
Yes.
So this is so multidimensional and the effects in our lives. And I think women are just so go-getters, right? They're like, it's not a big deal. It is a big deal. And the important thing is that it can be fixed in a way with minimal side effects. It sounds like Dr. Drouaye. And that we can rejuvenate things and letting your own body come in and heal things. So absolutely. I think that's amazing. I'm so glad you were actually able to share this and actually even break it down because a lot of times women don't even know that there are 3 tiers, right? And they're just kind of stuck either at the pharmacy or just using the pastries. It's not working for them, but they don't know. Well, I better go back, talk to my doctor, go find Dr. Drouaye in Chicago and I get things fixed.
Yes.
So can you tell us a story? You did allude to one already. Can you tell us a story about a patient of yours who had an amazing benefit? Because I think it helps our patients to be able to kind of stand in that patient's shoes.
Oh, absolutely. There's a patient of mine who came to me for urinary urgency, or what we call urgent incontinence. So she's in a meeting and she has to literally jet out of the meeting to go to the bathroom, because if she tries to hold her urine, she's going to have an accident.
No.
So once she feels the urge to pee, she has to go immediately, otherwise she'll pee on herself. And so it had become embarrassing for her because she'll have to interrupt the conversation and rush to the bathroom. And people are like, what's going on with you? And, you know, it's not something you can easily discuss with a coworker or a colleague or a boss or something like that. And so she was like, so initially I had treated her, I thought maybe she had fibroids. So I did an ultrasound. The fibroids were not that big. Fibroids can sometimes push on the bladder and cause urgency, but hers were very small. So I sent her to a urologist. The urologist started on this medication. And I was like, how are the results? She's like, not as minimal. I said, let's try this laser thing. I gave her, she had one treatment of the laser, and a week or two later, I was following up with her, and she said that she can hold her urine better. And then after the second treatment, she doesn't have the urgency anymore. She said, you gave me my life back. You gave me, I feel normal. I feel like a normal person again. I can hold my urine until I'm ready to go to the bathroom. Nobody has to know that I gotta pee.
Goodness. And it's interesting, right? And she just accepted that this is one of the things I have to deal with. Excuse me, I need to leave this meeting right now. I'll be right back.
I'll be right back.
And not really knowing how, you know, and she has to think about that. So half of it, she's a little distracted even before she has to leave, right? Because you're thinking, how long can I hold it? I need to go. What part of this meeting should I interrupt so that I can go and come back?
One of the things she does when she first gets to a place, she has to go pee, because she doesn't want it to happen in the middle of the event or the meeting. And the other thing is the fact that she was like, I just feel that I'm a normal person. I just feel that I'm a normal person again. Nobody needs to know my private details.
Yes.
You know? And then the benefit of it, that aside from the bladder control, is the increased sexual pleasure that she's now exposed to. And so she's a very, very happy patient. She wrote me a wonderful review that I love to share. I love to bring it out to my other patients and say, look, this is the result of one of my patients.
This is what happens when you get treated by Dr. Duroy, even more than you bargained for. Wow.
Absolutely. She hasn't even had her third. She hasn't even had her third treatment. So she still has one more treatment to go to complete and what I love about it is you don't have to keep doing it, right? That once the 3 treatments are done, you're good for a year. Some women don't even need a retouch. Because we get older, changes happen again. Maybe once a year you get one treatment and that's it to maintain. But my younger patients don't really need a retouch because they still have estrogen to help support. My older patients, maybe once a year. So the convenience of it, the high quality results you get and the convenience of it is what I love about it.
Yeah, I can imagine the difference in somebody who's been using a lot of the pastries and stuff, and then it's almost freedom.
Yes.
Right. Yeah, it is. It is freedom. Wow. Okay. Well, you know, on our show, we like to make sure we've had so many wins already. I'm not even sure. I should even ask for more. But you know, I'm going to ask for more. So, you know, promise everybody listening that when they leave, that we're going to give them 3 wins, right? 3 things that our viewers can implement to become healthier versions of themselves, kind of, you know, thinking about the topic of women and vaginal dryness issues. So tell me 3 things that they can do to become a healthier version of themselves, to kind of live better and healthier.
Absolutely. So I thought about this. One of the first things that I have started implementing in my life is, you know, centering yourself before your day starts. Because, you know, getting a little bit of time to yourself because I'm a Christian, so I read the Bible, I meditate, I pray. It really helps me manage my emotions throughout the day. So my interactions with people are better. My reactions to situations are better. I'm just more level, more grounded.
Yeah.
And so
Yeah.
I always
Yeah.
say, before you start your day, don't just rush out of the house. Then you're just reacting to everything that's happening to you. You're at the mercy of the universe at that point.
Yeah.
So I recommend, so if someone is not a Christian, I would say meditate. It might be 10 minutes, it might be 5 minutes. Just center yourself before your day starts so you have more control over your day. My second one would be, don't wait too long to talk about something. Don't wait too long to talk about, any issues you're having. Like some women, all the symptoms of menopause is joint pains.
Yeah.
So they've been to a rheumatologist, there are medications, things are getting better, but there's this estrogen deficiency part that hasn't been addressed. And so I always say, or my patients who are having spotting after menopause and say, oh, maybe I was just working too hard. Maybe I just stretched. No, 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 no. You've got to talk to your doctor about anything that looks abnormal that should not be happening. Oh, I haven't seen my period for 6 months, and suddenly I have this 12-day flow. No, no, no. You don't ignore that. You talk to your doctor about it.
Yes.
My third one would be to move. Move, move, move. Get your heart racing. I've actually stopped sitting at work. I'm always standing now. So that way I get the urge to move, because that reduces your blood pressure. It reduces stress. It reduces anxiety. It kind of gets the blood flowing, flowing. So move, see a doctor early, and center yourself.
Thank you. Those are amazing. And I'm going to share with you, actually, my desk has always been standing at work.
Nice.
It's a standing desk, but I put it at sitting for 75% of the time. So actually a week ago, I moved it up to standing and I left it there permanently.
Excellent.
Yeah, because sitting is could even be worse than smoking. Right? Sitting, we sit everywhere. You drive, you sit, you sit, you sit, you sit, you sit.
Yeah, you sit at home, you watch TV sitting.
It's, you're chatting on the phone sitting. So my day now for the last 1 week, I just said, you know what? Enough. So I, stand out and I have my sneakers. I put them on.
Exactly.
If I need to meet somebody that shouldn't see me in sneakers, I change my shoes.
Yeah, I have shoes, different kinds in my office too. Yeah, so I can
whatever it takes, right?
Yeah.
Whatever it takes, right? We're all living longer and we want to make sure we have a great quality of life.
Absolutely.
Also, I have a fun question for you, right?
Yeah.
So what superpower do you wish you had and why?
I thought about this, and the initial one that came to my mind was I wanted to read people's minds. Like I want to be able to turn it off and turn it, but actually I don't think I want that.
Okay. You may see stuff you don't want to see.
I don't want to see, exactly. I may be, no. I would like to preserve what I know of people. So I started thinking maybe I want to know the future.
Okay.
I'm such a perfectionist. I like to do things well. So I want to know if it's not going to work out, then I don't want to do it. But as a Christian, when I think about that in the context of being a Christian, then that's probably why God did not give us that. So that we can just trust God and let things be as they should.
Yeah, that is true.
Yeah, in an ideal world, that would be what I would want. I want to see the future.
Yeah. Well, I already know that about you, that you are a perfectionist and your patients benefit from that because she's gonna dot that I because she's gonna cross that T. She's gonna make sure that nothing slips through. So if you're looking for an amazing gynecologist, get rid of the vaginal dryness issues, 60 is the new 30,
Absolutely.
let's find Dr. Taiwo Durowade and let her just handle things for you. So everyone, thank you for watching. But I have one question. How do people find you? Because everybody wants to find you right now. Please give them the info. And then we're going to put it in the show notes too.
Okay. So the name of my practice is DARDUR, DARDUR, gynecology. And I'm in the Chicago land area. So you can find me through dadomedical.com, Dado Gynecology on Facebook, Dado Gynecology on Instagram, LinkedIn, YouTube, Dado Gynecology. I have videos, I have posts. I'm on TikTok too, Dado Gynecology. So all the social media platforms. And my website, dadomedical.com.
Okay, perfect. So thank you everyone for watching. Remember to subscribe to our YouTube channel at Healthy Joints and Healthy Lifestyle. Share with someone who may benefit from this. Like this video. Every week, we promise to bring you hints to a healthier version of yourself. Dr. Tai Durowade, thank you. This was a wonderful time together.
Yes,
Totally
it was.
enjoyed it. Appreciate you coming to the show. And hopefully people will find you soon because there's so much good you're doing in the world.
Thank you. I really appreciate that. Thank you so much. This was fun.
Okay, thank you. Take care.
Okay.